A pear can support bowel regularity and heart health, but the result depends on structure, substitution, and tolerance. One medium fruit combines water, chewing, and fiber, the plant material your body cannot fully digest. Those features may soften stool, feed useful gut bacteria, extend fullness, and support healthier cholesterol handling. The strongest benefit appears when the whole fruit replaces a weaker snack and the serving remains comfortable enough to repeat. The intact structure slows eating before digestion begins. Plant cell walls hold water and natural sugar inside the flesh. Chewing opens those walls gradually and gives fullness signals time to develop. Food form changes what reaches the body. Juice loses most fiber, dried pear loses water, syrup adds sugar, and blending removes much of the chewing. Water-packed pears remain closer to whole fruit. I'm Dr. Kim, a licensed physician. This is not medical advice. Consult your doctor. A medium pear provides about 5 to 6 grams of fiber. Pears contain both insoluble and soluble forms. Insoluble fiber adds bulk to stool. Water helps that bulk remain soft enough to move comfortably. This can reduce straining when dry stool follows a low fiber pattern. Soluble fiber mixes with water and forms a gel. Pears contain pectin, one gel-forming fiber. This softer material can improve stool texture without forcing a sudden bowel movement. The pear's water supports the fiber package, but ordinary drinking still matters. Too little fluid can leave added bulk dry and less comfortable. Part of the fiber reaches the colon, the final major section of the intestine. Bacteria ferment it and produce short-chain fatty acids. These small compounds help fuel colon cells. The peel adds fiber and flavonoids, which are protective plant compounds near the surface. Washing preserves more of them than peeling. Texture preference can still guide the choice. Pears should remain one part of a varied fiber pattern. Beans, oats, vegetables, nuts, and other fruits provide different structures. Variety feeds more types of gut bacteria. Soluble fiber also supports heart health. It can bind bile acids, substances used to digest fat. The body uses cholesterol to replace bile acids that leave the digestive tract. Over time, this process may help lower harmful cholesterol in the blood. The food swap can create an even larger benefit. A pear instead of pastry lowers refined flour, added sugar, and saturated fat. Replacing chips lowers sodium and adds potassium. Count the weaker snacks that disappear. A pear replacing a packaged snack changes the weekly pattern. A pear eaten after that snack only increases total intake. The same fermentable fiber can create the opposite bowel result. Pears contain sorbitol, a sugar alcohol, and carbohydrates that ferment rapidly. Water can enter the intestine while gas builds. Bloating, cramps, or urgent diarrhea may follow. Temporary gas can follow a rapid fiber increase. Persistent pain, loose stool, or urgency after comparable servings is different. That pattern argues for less pear, not more. Meal context changes the threshold. A pear may feel comfortable alone, but uncomfortable after a large dinner. Beans, onions, or several fruits can raise the fermentable load. Not every constipation pattern is a fiber problem. Pears may help dry stool caused by low fiber. Constipation from medicines or poor pelvic muscle coordination may respond differently. Use one controlled trial. Hold the pear portion and fluid intake steady, avoid other major diet changes, and record the response for several days. A useful response often takes several meals. One pear may not change anything the same day. Repeated servings under similar conditions provide a clearer answer. Keep a short daily record. Note stool form, straining, gas, pain, and urgency. Written patterns are more reliable than one memorable bathroom trip. Judge several days together. Easier stool without major discomfort supports continuing. Repeated bloating, pain, or loose stool supports, reducing the serving or changing fruits. Digestive timing can blur cause and effect. Today's stool may reflect several earlier meals. Compare patterns across days instead of blaming the last pair. Choose the smallest effective portion. Extra fruit does not guarantee extra benefit and may add fermentation. A practical serving works without disturbing the next meal. People returning from a low-fiber diet should increase slowly. Hold one serving until the response becomes predictable. Change one variable at a time. Judge regularity by comfort and stool form, not by the clock. Soft, formed stool that passes easily is useful. Urgent or watery stool is not improvement. Fruit size changes the practical dose. Half a large pear may equal one small pear. Use the same bowl, palm size comparison, or repeated cut size during a trial. Natural fruit sugar remains carbohydrate. Whole fruit preserves fiber and chewing, but a large pear still contributes more carbohydrate than a small one. Keep the habit only when one result becomes clear. Stool becomes easier, a weaker snack disappears, or fullness lasts longer. Comfort remains part of every successful outcome. Meal composition changes the useful portion. A whole pear can suit a standalone snack. Half may be enough beside bread, cereal, rice, or oatmeal. Pairing can extend fullness. Nuts, cheese, or plain yogurt add protein or fat without burying the pear in sugar. Sweet toppings weaken the replacement benefit. Removing the peel can improve texture but reduces some fiber. Sorbitol remains in the flesh. Heat softens the fruit without solving every digestive reaction. A different fruit can meet the same goal more comfortably. Kiwi, oranges, and berries provide fiber with another mix of fermentable carbohydrates. People with chewing difficulty can poach pear halves until tender. Gentle cooking preserves much of the fiber while making the fruit easier to manage. Ripeness mainly changes firmness and eating speed. A firm pear needs more chewing, while a soft pear works easily in oatmeal or plain yogurt. Asian pears are often crisper and more watery. European pears soften as they ripen. Variety changes texture more than the basic fiber principle. Product labels can make a sweetened pear food look simple. Check the ingredient list for syrup, concentrated juice, and added sugar before buying. Dried pear needs a measured portion. Water removal makes a small amount represent more fresh fruit than expected. Check for added sugar. It also provides much less water than fresh pear, so it does not offer the same hydration support. Choose canned pears packed in water or their own juice. Heavy syrup adds sugar, and eating from the container makes portions harder to see. Pear nectar does not reproduce whole fruit. It offers little chewing and usually less fiber. A large glass can disappear before fullness develops. Frozen slices preserve fiber and reduce waste. Thawing softens the texture. They can replace sweetened toppings in plain yogurt or oatmeal. Divide cut pear into single servings before storage. Visible portions improve consistency and make symptom comparisons more reliable. Place washed pears where a packaged snack usually appears. Breakfast, lunch, or afternoon can all work. Placement matters more than a perfect hour. Wash fresh pears under running water and rub the peel with clean hands. Ripen firm fruit at room temperature. Refrigerate it when the stem area begins to soften. Blood in the stool, ongoing constipation, weight loss, vomiting, or severe abdominal pain needs medical assessment. These are not ordinary signs of a simple fiber adjustment. A useful pear habit combines whole food structure, meaningful substitution, and a tolerable serving. Choose the whole fruit, track one visible benefit, and keep the smallest amount that works comfortably. Medicine, simplified. That's what this channel does. For more, hit subscribe. This is not medical advice. Consult your doctor.